Good. Well, there are quite a few people now here, so I'm gonna hand a very short introduction from me from sunny Hungary, from sunny Pech. Pech is such a beautiful city. I really would like to go back there. Um, so welcome to the latest edition of the Ealthy Professional Development webinar series. Um, I'm Chris. I'm one of the directors of Ealthy. I also represent Specialist Language Courses, SLC, and we work together with Ealthy to promote these webinars. We publish, as you know, all kinds of online medical English materials. Um, I'm delighted to be joined by Petra, who's the Ealthy Membership Secretary. Petra is the one who will support you if you want to be a member. She will help you find all the resources that we have in our members area, and that's where the webinar recording will also be held, along with all the other many professional development webinars that we have organized over the years. And then a very familiar face to everyone here, we have Roz, a medical English advocate, writer, teacher, trainer extraordinaire. And then we have Reena, who's going to be giving the webinar. So I think that's kind of enough for me. I'm going to turn my voice and camera off very, very shortly. I'm going to hand over to Roz to make a more formal introduction for the webinar. So over to you, Roz.
Hi, everybody. Thanks, Chris. Yes, wonderful to see everybody this morning, and lots of familiar names, and good to see you here. So I first met Reena probably about a year ago, and we did some work together. And I was really pleased when she said that she would deliver a webinar for us today. So Reena is a former community pharmacist. She hails originally from Yorkshire, but is now living in much sunnier climes in San Sebastian in Spain. So lucky Reena, where I think she's been there for about 7 years. So she's now looking to, although she's been working in general English and business English for the last few years, she's now moving into her speciality, which is great. So combining her pharmacy experience and knowledge with teaching of English as a foreign language. I don't think what the expression was then. So the webinar that she's going to deliver for us today is entitled How to Keep Your Cool While Handling Heated Situations in Pharmacy, or in the Pharmacy. But I think it probably extends to other areas of English for healthcare as well. So even if your learners are not in pharmacy, I'm sure there will be lots to learn. Okay, so thank you very much, Reena, and I'll just hand over to you immediately. There we go. Thank you.
Hey, thank you, everyone. So my name's Reena. If you just bear with me one moment, I will try and share my slides. Okay, so here we go. So how to keep your cool while handling heated situations in the pharmacy. So the main aim of this workshop really is just to share some examples from some of the situations I've come across in the pharmacy. So I'm going to share two examples, and we'll look at some strategies to handle them. We'll also talk a little bit about inclusive language and behaviour, because as health professionals, as medical English trainers, it's important that we ensure every patient is treated with the care and dignity they're entitled to, so that they will want to return to your pharmacy and recommend it to other people. Okay, I'm curious to know who's in my audience. I mean, primarily this is for healthcare professionals who have English-speaking patients. So you could be based in your home country, and you may have international tourists who are using English either as a native language or as a lingua franca in order to communicate with you, or perhaps you're based in an English-speaking country. or you're a medical English trainer or an English teacher, or perhaps you're just curious to find out what this is all about. Okay, so the outline of the session is I'm just going to start with a quick poll. So I could see in the chat that you're from all over Europe, from what I could see. I'd love to know what your job role is. Are you a medical English trainer? Are you a healthcare professional? Um, could you let me know in the chat, please? Okay, so I can see there's Helen, or obviously I can see some familiar names. Medical English and OET teacher, medical English trainer. Oh, course developer. Okay. Well, farming single languages, interpreter. Okay. Are there any other health professionals here? Oh, interesting. English for pharmacists in Sweden a long time ago. Okay. So I'll move on to a little bit of my background and how I ended up where I am. Okay, so sorry, I should have shared this earlier, but everybody's answered this question. So my story began back in England. So I was born in Bradford. So this is a large city in Yorkshire in the north of England. But I grew up in a small village called Birstall, which is just outside Leeds. Here's a picture of me when I was younger. I think I must have been about 1.5 years old with my dad. So I'm the daughter of Indian immigrants. So I've always been brought up with some aspect of my Indian heritage, as well as British culture as well. I moved to San Sebastian, where I still live now, in 2018. So I guess one of my first students really was my dad, because he's multilingual. English is his, I think, third or fourth language. So even as a child, I was ineffectively helping him. Okay. When my first degree was pharmacy. I studied pharmacy at the University of Bradford, and I did what was called a sandwich course. So as part of the course, we have to do a pre-registration placement. And I spent 6 months in hospital pharmacy in Ipswich, which is in East Anglia in the south of England, and then 6 months with a large pharmacy chain, and I was based in Barnsley. After I qualified, I worked mainly in Yorkshire. So I first worked for a large company. I started off as a relief manager for their chain of pharmacies in the Leeds area. And then I became a pharmacy manager in a quite diverse part of Leeds with many patients came from a lower socio-economic background. And then I locumed. I did some locum work, and And this picture was taken in one of the pharmacies in North Nottinghamshire. And we were all dressed in red because we were doing a health campaign about heart disease, and we were raising money for the British Heart Foundation. Okay. And then what happened was back in 2016, I went to Poland and worked at a business English camp. So this was a week-long immersion program where I was working with business professionals. And this is Kasia. So Kasia is a scientist based in, I think, Poznan in the north of Poland. And she's a specialist in diseases which affect potatoes. So if you want to know every tiny fact about potatoes, then Kasia is your person. And then, yeah, I was quite intrigued by teaching. And at that point, I fancied a little change from pharmacy. I wanted to see a little bit more of the world. I'd had a wonderful time working with these business professionals. So then I went off to Colombia and became involved with a voluntary program working in state schools in Colombia. So what they did was they placed people from various countries around the world. So some of us came from a teaching background. Many of us didn't, and we assisted the English teachers based in the high school with the listening and speaking activities, as well as sharing, our cultural knowledge and festivities from our home countries. So we did have people from all over the world. So there was myself from the UK, but I also used it as an opportunity to share some of my Indian culture. So I'm stumbling over my words because of nerves. And Ghana, Australia, you name it. Okay, so it was a wonderful opportunity for them to learn a little bit more about English speakers from around the world. Okay. I mean, we're talking a little bit about inclusion. So again, this is something that I became more involved with when I moved to San Sebastian. So my first official teaching role was with International House, and I became like heavily involved with teaching general English, business English, from levels A2 to C1. Young learners, you name it, but basically everything apart from medical English. And due to some conversations I had with some other teachers pictured below about comments in the classroom about different nationalities or gender, we set up a special interest group for diversity, equity, and inclusion. And we ran some workshops for teachers about how to handle, things like homophobic or transphobic comments, or when comments are made about different races and nationalities. So it all kind of developed from there, really. Neil Harris. Yes, I do. Yeah, I know Robert extremely well. He's a good friend. Okay. So, what's happened there? What's happened? Okay, sorry, I've jumped a few slides. well, not few. Okay, there we are. So I have a little activity for you. So we have some words and phrases here. Some are more commonly used in the past. Some are considered more offensive than others. What I'd like you to do in the chat is, you can number them 1, 2, 3, 4, 5, 6. Could you suggest some more inclusive words and phrases that could be used? So taking wife or husband as an example, it's not offensive, but one thing that I had to, especially consider working in a school, working with children, is that not every child has mum and dad, or their parents are married. Some children have single parent families. Some children have blended families. So let's have a look. Yeah, excellent. Yeah, so partner, spouse, parent. Some good suggestions here. Okay. Example. Yeah, some children may not necessarily live with their parents either, so they may live with a grandparent or a foster parent. Yeah, excellent. Yeah, so half caste is like a word that I haven't heard for quite some time, but you might find it in some older literature. Yeah, some mixed race. Some people prefer biracial. I think, if in doubt, follow the lead of the person and how they prefer to be addressed. Yeah, disabled. So I'm just going to move on to the next slide. Okay, mixed heritage is good. Yeah, excellent. So these are some of my suggestions. Okay. So again, there's identity first, or there's person first. There are, several like social media accounts that I've been following from people who have a disability, and they're not a monolith. Some of them choose to refer to themselves as a disabled person because it isn't taboo, in their eyes. They have a disability or they are disabled. So we have identity first, or person first, and that depends on how they would like to be addressed. Again, yeah, wheelchair bound suggests that it's the wheelchair some kind of prison, whereas it's just an accessory to allow them to be able to function in the society that we live in. Yeah, it just allows them to move around. So many prefer wheelchair user. With regard to transsexual, again, the problem with a lot of these terms is that they're constantly being yeah, okay, yeah, I see your point. Yeah, transgender man, transgender woman. Some people prefer to refer to themselves as like non-binary. Yeah, no need to apologize. Again, these are some suggestions, and again, I think it's always better to follow the person's lead in this respect. Yeah. Okay. Okay, so let's have a look. So here are just some general tips regarding behavior. From personal experience, I've noticed that, some people are not necessarily forthcoming about how they feel. And this is another thing that we came across in Ros's course, is to be aware of and try to notice non-verbal clues. Like, do they seem embarrassed? Do they look as though their face is flush? Do they look, upset? And, suggest, to make them feel a bit more comfortable. Would you like to speak in the consultation room? Um, Another thing is like checking your positioning as well, making sure that you're facing the patient and that you're at the same level. Um, so, for example, yeah, sitting down. What I don't recommend is crouching down if you're talking to someone who's shorter than you, or if they're a wheelchair user, because it could be seen as quite patronizing. So if you need to speak to a wheelchair user, just take a chair around and sit down at their level so that you're facing each other directly. Again, as mentioned, user language operation prefers to address themselves. Again, when you're giving information about how to use medication or how to apply a cream, use clear communication. So, for example, apply thinly 3 times a day. Use the visuals as well. So if you're explaining how to take a particular tablet, show the box too. I also recommend checking for understanding, because I often find, like, if you ask a yes no question, like, do you understand, they probably just yes or nod their head, because they might be too embarrassed to say that they don't understand, or perhaps they are a little bit nervous, they don't feel particularly well. So I would address it as, I'm checking that I've explained things clearly enough. So something on the lines of, oh, I just want to check that I've explained this clearly. Could you tell me what you need to do? And then you can just check, okay, they've understood clearly, and fill in the gaps if need be. Be aware of also how symptoms may present differently. So one example would be a skin rash. They can look differently on different skin tones. And if you think in the past, when we've looked at medical textbooks, there were few examples perhaps when you were training or when your students were training of them being shown on a diverse range of different skin tones. So I have provided a link at the end of a useful website. I think Ros also has this on her website as well. And I believe the guide is free, so you can see different examples on different skin tones. Again, be accountable. At the end of the day, we're human. So there will be occasions where we may make the mistakes, we may say the wrong thing, and it's just to take ownership of that. Apologize straight away. Ask how you could make amends. Okay. Another thing as well is regarding premises. So, is your pharmacy accessible? Do you have a wheelchair ramp to make it easier for wheelchair users to access your building? Are there, I've forgotten the name of it. Sorry, my mind's gone blank. But do you have a facility to enable patients who are deaf to hear more easily? Are your products located on shelves that are easy to reach? Do you provide a consultation room for conversations where your patient may feel embarrassed, or if it's a sensitive uh, conversation, like for example, if someone's requesting the morning after contraception, 11L, do you have a private consultation area so patients can speak freely and you can ask those questions without the rest of the pharmacy hearing about it? Okay. So we're just going to look at a couple of scenarios before we finish up. I'm just going to have a look at the chat. Brilliant. Okay. Yeah, exactly. Yeah, not touching a wheelchair because it's that person's personal space. Okay. Also not automatically helping, maybe asking, okay, would you like any help? The talk back protocol. Okay. Yes, definitely. I absolutely agree, Neil. Wheelchair mount. Okay, so back to the slides. So this was a scenario which happened. I need to give you a disclaimer. I haven't actually worked in a pharmacy for a number of years. So imagine some of the processes, at least back in the UK, may have changed since then. But certainly when I was practicing, we had the electronic prescription service where prescriptions were sent direct from the GP surgery to the pharmacy, which the patient had signed up to receive their prescriptions. Okay. So unfortunately, this doesn't happen all the time, but when it does happen, it causes absolute chaos. So I want you to think of perhaps some suggestions. The electronic prescription server is down, so you cannot receive the prescriptions that patients are expecting. The chemist is packed with customers waiting for their prescriptions. If you imagine, they may have to return to work, they just may be exhausted, they don't feel particularly well, they just want to go home. Perhaps they've come with children and the children are getting incredibly restless. And yeah, they don't look thrilled. What do you do? Can you type in the chat any suggestions? Okay, let me have a look. Yes, keep calm. Brilliant, Neil. Yes. Yes, managing expectations. We know that the electronic prescription server is down, but the patients do not know. So yes, we have to take ownership of that and clearly explain what has happened and what that means for them. Wait a little bit. I probably should have given a bit more context here. We had no idea how long this was going to take to resolve. Okay, does anyone else have any other suggestions? Okay. Also, I mentioned, my customers. What about the staff? as well, because we have pharmacy assistants generally on the counter. So they're the first port of call for the patients. Okay. Then we probably have a pharmacist. We have at least in one of the places I worked in, an accuracy checking technician, various pharmacy technicians as well, working in the dispensary. So you have a number of people. So they all have to be given the same information as well about what to do. Okay. Do we have any more suggestions, or shall I move on to the next slide? Okay. Yeah, so I mean, reiterating what Neil said, just be honest, apologize for the inconvenience. Yeah, exactly. So staff explained what happened and brief them on what you want them to do. So it could be a case of whoever's serving at the counter explains what's happened. You could perhaps, for example, if there are people who struggle to get out, perhaps they are older people, perhaps they are people with a disability, perhaps they have children to look after. If you offer a delivery service, you could offer to deliver the prescriptions later when they are resolved. If there is something absolutely urgent and they need an antibiotic, perhaps you can liaise with the GP surgery, call them and see if they will issue a handwritten prescription. Also, if your service is usually linked to the labelling system as well, there are certain legal requirements that need to be on a pharmacy label. So I suppose this really applies more to the UK than anything else. So again, you just have to explain, we have to handwrite the labels, we have to include everything by law. So this will take longer than usual. People in general don't like to sit still if they have nothing to do. Time seems to take longer if they're not occupied. So perhaps you could provide, I don't know, leaflets to look at in the pharmacy seating areas. Some pharmacies I've worked at also have a TV with a news channel. Again, if you're trying to encourage people to come back for business, you could highlight a campaign you're running, or any new products that you have, so they can have a look at the products. Again, so we talked about prioritizing urgent cases and offering to deliver medication later. Yeah, default communication styles. Again, yes, clinical need, not who shout the loudest. Okay, so for example, if it's repeat medication, they maybe have a few days medication already, in which case it's fine to deliver it later. If somebody desperately needs an antibiotic or a painkiller, they're physically in pain, then that is more urgent. If need be, just be honest and explain why. But yeah, that's an excellent point. Okay, let's move on to the next one. Oh, this is another scenario. Again, a customer wants to buy several boxes of decongestant. So this is one that's happened to me. So they wanted Sudafed, which contains pseudoephedrine. They've already spoken to the pharmacy assistant, who's then referred them to you. And as you can see in the cartoon, he looks furious. He wants to know, why can't he buy 3 packets of Sudafed? How would you handle this? So please, could you put some of your ideas in the chat? Yes, take them to another room or a quieter area of the pharmacy, because the last thing you want is for somebody to be shouting when there are other patients. Okay. Because that maybe put them off returning to the pharmacy. um, but then, yeah, if you feel safe to do so. So when this actually happened to me, I was in a large pharmacy chain, but we had a security guard. So I made eye contact with them just in case they needed to intervene. Yeah, excellent. So listen to show interest. So it's very tempting to just speak straight away. Yeah, support your staff member. We're offering a way out to the customer. Exactly. Okay. So that's one thing that sometimes gets missed as well. We have a duty towards our staff members, as well as our patients as well. And any, aggressive behaviour should not be tolerated. But at the same time, there are ways in which to de-escalate it. In many situations, it's because they don't understand the legalities. Like for them, yeah, exactly. You're mirroring his language. So you understand. Okay, so I understand that you want several boxes. Perhaps they don't want to keep returning to the pharmacy. But yeah, explaining that we could only, sell one box, and then we also have to check that it's suitable for what they need. I mean, pseudoephedrine is something that has been abused, but I maybe wouldn't tell them that. I would maybe go for like the legal aspect that, oh, we can only sell one box. Okay. And yeah, try and find out why he wants them. It could be something not, that isn't sinister. Perhaps he wants to buy a pack for their neighbor who can't get out. And yeah, yeah, offer alternatives. Okay. Yes, exactly. Yeah, don't interrupt the patient. Um, Brilliant. Okay, so I think they're all excellent suggestions. Yes, so brilliant. Yeah, asking them to come to another room and just listen. Yeah, so if safe to do so, take them to a quieter room. Okay, and show that, yeah, you understand their concerns. Okay, and I think it helps calm them down when they know that they have been listened to, or they felt listened to and given the space to be able to ask questions. Okay, so I am going to move on to questions. Does anyone have any questions? Yes, yeah, that's true. I mean, we always ask about symptoms. Is it for themselves? Are the tablets for themselves or for someone else? And we find out. Okay, yes, I think pseudoephedrine is used to make methamphetamine. Yeah, so this is exactly why they have these restrictions. Okay. Another thing as well, if you do suspect drug abuse, misuse, there is usually a cascade where you have to inform other pharmacies if there is a customer who's like aggressive or suspicious, who might be doing the rounds and going around different pharmacies requesting. Another one as well is kaolin and morphine. I once had a woman want to purchase 6 bottles of kaolin and morphine. And again, same strategy. Okay. So any questions at all? You can type them in the chat. Okay. So I have a list of some further references. It's about like microaggressions. There's an interesting article here in the Pharmaceutical Journal. So microaggressions are these like everyday slights that can offend people when they're repeated, but maybe on first sight, they don't appear to be harmful, such as like, where are you really from? Or making assumptions about people based on their appearance. Okay, and then this was the resource I mentioned with a link to a free downloadable guide that shows you various skin conditions such as like eczema or bites. Okay, facing frustration, would you use tentative language or instructive simple language? Ooh, could you be a bit more specific, Beata, if you don't mind? I mean, I suppose I would keep it quite simple. But I'd use like empathetic language. So yeah, I understand. Okay, in wider sense for patients at home. Yes, because I mean we can't assume that everybody knows all the medical terms and jargons. I would keep it, fairly simple and check understanding. Another point to mention is not all your customers have the same level of English, and that's even if you're based in an English-speaking country. So I often worked in areas where some of the patients may be on holiday, they may be visiting family, or they were recent immigrants, and perhaps English wasn't their first language as well.
Reena, I have a question.
Sure, yeah.
Going back to when we were talking about how you referred to people, if a member of staff in your team had made a mistake referring to somebody in a particular way that you sense that the patient hadn't really appreciated, what advice would you have given them in terms of apologizing?
Okay. Oh, so I mean, in this case, I mean, I'd first speak with a staff member, and just explain that, I think the patient felt uncomfortable with it, with this remark, although it wasn't done in malice, and they prefer to be called this, particular term, and just going to the patient and asking them to say, oh, I'm sorry for the offense. How can I make it up to you? What can I do better? Or how do you prefer to be called?
what do you prefer? Yeah, what do you prefer? Yeah, yeah. So sort of apologizing and then moving forward and not
And
making
then
too
moving
much of a big
forward,
deal of it. I guess that's probably the best way, I guess, right? Hmm. Okay, good. All right, thank you. We do have another question. Valeria has said, "Are there any penalties for malpractice?" I guess there are.
yes, there are. Okay, yeah, if there's patient harm, yeah, you can go before, well, at least in the UK anyway, um, the General Pharmacy Council will contact you.
Hmm.
And it's always important to have indemnity insurance as
Can you
well.
explain what that is? I'm not sure that everybody would necessarily know what that meant.
That is okay. So when you're practicing, it's an insurance that you policy that you need to take. Yeah, an insurance policy that you need to take out. So some employers offer it, maybe perhaps as part of a working package, but I would strongly advise taking out your own personal indemnity insurance just in case there's any dispute between you and an employer you're working for.
Okay, all right, interesting. Okay, all right. Valeria, thank you for that. Just wondering if there are any other questions that people might have for Reena, because I know that a lot of people, when we saw in the chat originally, a lot of people are working with pharmacists. Is there anything that's sort of come up in your discussion with pharmacists or pharmacy students in terms of their dealings with patients that Reena might be able to answer?
Yeah, that would be useful actually.
I've never worked with pharmacy in anything to do with pharmacy, so this is all very new to me. It's not an area that I've ever, I've never
I
worked
would
with.
love to hear more from people who've been teaching pharmacists.
Mm, mm. Well, technically, we have several people in the audience who've done that.
Um,
Just seeing if there are any questions. Okay, all right. So you're working with pharmacists at the moment in France, not in France, in Spain. Is there anything specific that you have noticed in the way in which they deal with their patients? Any sort of anecdotes that you've experienced?
I'm just going to show you something. So I've spoken to a number of pharmacists here, like based in the Basque Country, and a common theme is many of them have completed, the advanced Cambridge exams or the first certificate Cambridge exams, or they perhaps had some general English lessons in the past. They're competent, especially when they're traveling. Some of them have even worked in the UK, but the main issue they have is when they faced with a tourist on the spot and they're addressed in English, and it takes them by surprise because often the English is covered in the more general courses or the Cambridge exams, which there's a lot of pressure, especially here, for students to complete, and there's a lack of awareness about the OET and the benefits that it has specifically for healthcare professionals.
Okay.
Is that they often don't feel confident speaking to patients, or they're unsure of some of the terms. There are a lot of false friends.
Right.
For
Yeah.
example, like if you have sensitive skin, perhaps if a patient is trying to explain, okay, I've got a rash, my skin's sensitive, in Spanish it's sensible,
Like
which
in
is
French.
like
Yeah, yeah.
sensible. Yeah, so I guess there are some
Mhm,
common themes across like French and Portuguese as well, I think.
mhm.
Um, I'm trying to think what else.
Well, Neil has a point here. It says, I imagine a big problem is the common expectation of British visitors, and of which there will be many in Spain, that all staff in the pharmacy will speak excellent English, and that these visitors will fail to accommodate for the local staff and become aggressive as a result. And then, possibility of the need for intercultural training as well.
Training. Yes, there is that as well. I remember speaking to a pharmacist about this. I think they had a tourist from Australia, and they'd forgotten their prescription, and I think they expected the pharmacy to just be able to supply his medication. I think
Mhm.
I don't know. I'm not sure what medication it was, because he didn't tell me. But yeah, just advice on like referring them to somebody else or signposting to other services.
Right. Yeah.
And I
Mhm,
think
mhm,
sometimes it's just explaining clearly, like, I'm sorry, but legally, we cannot do that. However, if
mhm.
you go to this building here, they can help you. And then if you come back with a prescription, we can help you.
Mhm, mhm. Right.
And if
So
it's
transparency is really key in terms of keeping cool. Yeah.
yes.
Mhm,
Another one as well, because again, this is another cultural difference. So this doesn't just happen in pharmacies, but I
mhm.
suppose even in bars and shops, if there's
Oh,
an
sure.
issue, um, acknowledging people who are waiting, so they know that they haven't been forgotten about. So it could be something as simple as, um, "I'll be with you in a moment." Just making the eye contact. "I'll be with you in a moment. I'm just serving a customer."
Mm.
Okay.
Yeah, yeah. It's a lot about patient expectations, yeah, and which that's I guess that's kind of what Neil is alluding to. Well, thank you so much, Reena. Thank you for your insights, and thank you for your those nice little scenarios. I think they worked really well. It was really interesting to see the typical sorts of scenarios that our learners may well have to encounter in a pharmacy scenario, but also in other scenarios as well across healthcare. Similar sorts of questions and similar sorts of demands from patients. So thank you so much for your time. And just as a quick mention of your emergency tourist toolkit that people might find useful sharing with their learners, and the link is there. Will be on the slides as well. So thank you so much, Reena, and thank you everybody for joining us today. Okay, thank
Okay.
you,
Thank
Reena.
you everyone for listening, and I hope this will be helpful for your students.
Yeah, it's lovely. Thank you.